Joining us is Dr. Shannon Frattaroli, PhD and a prominent researcher and faculty member at the Bloomberg School of Public Health and director of the Center for Injury Research and Policy at Johns Hopkins University. Dr. Frattaroli has dedicated her career towards exploring critical areas such as firearm injury and prevention policies, and her research has had profound impact on both academic discourse and practical application. She has written numerous articles and chapters regarding her research examining the role of policy in improving the health of population. So with that, I will let Dr. Frattaroli take us away on her paper and good knowledge she has to share with us.
Thanks very much, Caitlin. So I will say I have a couple slides, but I thought we could mainly just have a conversation since I know we have some brief time here together, and it's we're an intimate group. So I'll just say a little bit about where I'm at Hopkins. We, of course, have a medical school like Colorado. We also have a school of public health like the University of Colorado. In addition, we also have a Center for Injury Research and Policy that I direct. The University of Colorado is a new sort of a month-old recipient of a similar award. So we're going to be working more closely with, some of your colleagues at the University of Colorado. And in addition, here at Hopkins, we also have a Center for Gun Violence Solutions. That center has been in existence for over 30 years. So we've been working in the space of gun violence prevention for a very long time. I personally have been working on this issue for more than 20 years. The work that I was asked to talk about today with regard to extreme risk protection orders and a paper that we published about 5 years ago on a physician's role in extreme risk protection order is something that has been a big part of my research portfolio in recent years. So I was pleased to get the ask to come and talk with you all about that as you're embarking on your own medical careers. So a little bit about extreme risk protection orders. Do people know what extreme risk protection orders? They're also known as red flag laws, ERPOs. Is this a sort of term that people are familiar with?
No.
Okay. So extreme risk protection orders are a law that we started working on we're celebrating the 10th anniversary. What extreme risk protection orders are, it's a civil court process that allows people, when they identify someone who's behaving dangerously and at risk of gun violence, so either interpersonal violence or self-harm, so suicide risk, they can go to a court and ask the court to temporarily prohibit that person from purchasing guns and temporarily prohibit them from possessing any guns that they already own. So this process may sound familiar to some of you because when we developed the set of recommendations that included extreme risk protection laws, what we did was build on an existing system of domestic violence restraining orders. So those are fairly well known if anybody's in the intimate partner violence space. Domestic violence protection orders have been around for decades. They're in all 50 states. And they're very much a part of the protections that we have in place for people who experience violence at home. So extreme risk protections orders are an expansion of that in a way. It extends beyond domestic violence and again, allows for the court to intervene before violence happens. So it's very prevention oriented. And say, we see you're in crisis, we see you're acting in a way that suggests you might be at risk of harming yourselves or others, just not a good idea at this point in time to have a gun. So when these laws first started coming online, most states were looking at including law enforcement as people who could initiate these processes, as well as family members and partners. Maryland, where I'm at, was the first state to pass one of these laws that included licensed healthcare clinicians. And at present, by my count, 6 states, including Colorado and the District of Columbia, now have within their ERPO statutes provisions that allow licensed healthcare practitioners to go to the court if they see a patient or they're treating a patient who, again, is exhibiting signs that they are in crisis and are at risk of committing violence. They can go to the court, present the reasons why they're concerned about their patient, and the court will decide whether or not to temporarily prohibit them from purchasing and possessing guns. So that's kind of the backdrop. At present, in 2024, 21 states in the District of Columbia, again, including Colorado, have these ERPO laws in place. But again, only a handful have opted to include physicians and other licensed healthcare professionals among those who can go to the court and ask for a judge to temporarily prohibit someone from purchasing or possessing guns. So the paper that Caitlin asked me to talk about, we started shortly after Maryland's law went into effect. We were getting a lot of questions from other states. We're getting a lot of questions from clinical groups saying, what does it mean for licensed healthcare professionals to be able to do this? What is it looking like in your state? We captured data on the ERPOs being filed, and we saw that less than 1% of those ERPOs that were being initiated by clinicians. So, even though healthcare professionals were able to do this under the law, it was just something that wasn't being used. And so the paper that I think you have all seen, what we did was to make an attempt to understand what some of the barriers were to, we were interested in physicians in particular, using this law. And so we surveyed 3 departments in our hospital here in Baltimore, psychiatry, emergency medicine, and pediatrics. And we asked them a variety of questions about their knowledge of ERPO. If they didn't know about it, we provided a sort of short paragraph describing it, and then said, do you see patients who might qualify for an ERPO under this description? And we asked them that question, and then we said, is this a tool that you would potentially find useful in your clinical practice? So that helped us to get kind of a baseline on how physicians in particular were thinking about this new law. And I guess this is where it might be helpful to have a couple slides that I can share with you, just to give you an idea of the responses that we received. So, again, we got, depending on what you're used to seeing in terms of response rates, get a little more than a quarter of the people who we invited to fill out the survey responded. In my experience, generally, this is a respectable number when we're talking about physicians. Hopefully you all will be better when you're in your practice roles about responding to research surveys such as this, but we were pleased with this 26% response rate. And of that, almost 100 people who responded, one person said that they had initiated an ERPO. But perhaps more importantly, what we learned from this survey was that there was, again, at baseline, a year after this law went into effect, there was very little knowledge of ERPO. So, overall, we had about 2/3 of our respondents who said they were not at all familiar with this law. So that's one explanation, right, as to why we're not seeing much clinical uptake. But again, we said, okay, well, regardless of whether or not you know about this law, we're going to tell you a little bit about that. And then we asked the question of, okay, so now you know what it is. Just give us an estimate of how often you see patients in your practice who might qualify for an ERPO and who you would consider would be eligible. And, if you look over here in this far right corner, you can see kind of the total responses that we get. And, the overwhelming majority were in the, 90+% said that, well, we see people who are behaving dangerously and at risk of violence at least a few times a year. But, there were many more who responded, I see them daily, weekly, monthly. So we're seeing in our respondents that this is something that they are certainly seeing in their daily practice, right? That people come in and they're sensing a crisis and a risk of violence. And then this last line on the table here asks, well, okay, so you're telling us about how often you see patients who might be at risk of violence. How likely would you be to use this ERPO tool? And again, I'll just sort of draw your attention over to this lower right-hand corner. And, there were, just under 90% who said, I'd use it. I'm not very unlikely to use it, but about half said that they were either somewhat likely or very likely to use this. So while it's not the case that all the physicians that we surveyed were ready to just sort of jump in and use this tool right away, we did get an indication that there was a fair number of people who responded to our survey who said, yeah, this is something that I could imagine using and that I could incorporate into my clinical practice. So that gave us some insight into, potential viability of this tool. But we also wanted to get a sense for what barriers might exist. And so we asked them their thoughts on what potentially could keep you from using this. And this might not be a surprise, but the most common response that we got was that time is really a problem, because when it comes to initiating this process, you both have to complete paperwork and you have to go to court. So, what the most common response was, we just don't have the time in our clinical practice to engage in this type of intervention. There were some people who were concerned about how this might impact their relationship with patients, but by and large, this was really an issue of time that they saw as really standing in the way of their ability to use this tool. So finally, we also asked them about, okay, given those barriers that you identified, are there ways that you could see would be helpful in terms of supporting you in your clinical practice to use this tool? And one thing that really stood out for us was that when we mentioned the option of providing a designated person who could serve as an ERPO expert of sorts who could kind of coordinate that effort, complete the paperwork, go to court to file the petition, that was something that really resonated with them. And they thought that was an addition to the clinical setting that could really make this a viable tool. They also identified ERPO training, so just raising awareness and knowledge about what extreme risk protection orders are, having the ability to consult with counsel or people who are informed on the liability and risks associated with this. And then people also cited remote testimony, or the ability to go through this process without having to leave the clinic and go down to court in order to make this happen. So we got this information, and then we have been embarking on a process to take that first recommendation of putting in place a clinical coordinator who could handle the ERPO process. We've been involved with trying to get that off the ground. And I'm happy to report that we have got that funded. We're evaluating it at present. We're working with a community partner who is sort of staffing this clinical coordinator position. And these navigators are on call and available to clinicians at our hospital and a partner hospital whenever they encounter a patient who they feel might benefit from including an extreme risk protection order in their care plan. So that's a really brief overview of a little bit of background about what ERPO is, why it is that we decided to conduct this study, again, being in a state that was the first to include clinicians as petitioners in their ERPO law, and what we're doing, what we've done with those survey findings in terms of addressing the challenges that the survey identified to make ERPO a viable tool for clinical practice in Baltimore City. So maybe I'll just stop right there and ask if there are any questions, reactions, comments that people have, things you'd like to talk about.
I thought it was really interesting you actually mentioning about having someone there to be able to fill out the forms and show up in court, because I think that is a big contributor. I mean, I think there was like one story about that physician who like showed up in court one time on Zoom while they're in the operating room, because like there's just not time to always do those sort of things. And I think this is like especially one of those times where it's like you need to be there. I guess who do you think would fill that role? Do you think it'd be like case management? Would you hire entirely like new group of like social work? And then I have like another second part question to that, but I'll ask after that one.
Yeah, so in Maryland, the licensed clinicians who are authorized to initiate these processes include physicians. They include psychologists, they include nurses who are trained in mental health, and they include licensed social workers. So social workers, from our perspective, were really the right profession for this role. And the community partner that we're working with employs social workers as part of their crisis response team. There are social workers in our hospital that are in the departments of interest. So we really honed on pretty early on social workers as a good partner to bring in to fill that role.
Thank you so much. I see Teresa has another question.
Well, I put it in the chat, and so it looks like Karen Zhang answered for me, because I was looking to see if Georgia has an ERPO law, or what you're talking about is at a national level, or is it state by state or even county by county?
Yeah, so these are state level laws. There isn't a national law, and Georgia does not. We've been getting a lot of those questions, unfortunately, in the wake of the tragedy down there. Georgia does not have a law. They've had ERPO bills before their state legislature, but they have not advanced to law. But these are laws that happen at the state level. And again, there are 21 states and the District of Columbia that currently have these laws on the books. They don't happen from a statutory standpoint at the local level, but implementation does happen at the local level, as you can imagine. So the degree of engagement by law enforcement, by clinical groups, by community groups in this process really determines the extent to which you see this being used in counties across the states where they exist. So there's a good bit of work that's been done on Colorado's ERPO law. There's a couple of publications that have come out on how it's being used there. So Emmy Betts, Leslie Bernard, Emmy Betts, who's an emergency medicine physician there. You may know her. Leslie Bernard, Chris Konopke. Those are all people who are at your university and doing work in this space. But yes, the short answer is this is state level law, and Georgia does not have an ERPO law.
And if we had, would that have allowed them to take the guns out of the home last year when the child was being asked about his statements on social media about shooting up a school?
Yeah, so we have seen, so there have been based on the fact patterns that have been reported through the media about what happened in Georgia and in the little more than a year prior with regard to the encounter with the child's father and the child himself, we have seen similar cases where ERPO has been used to intervene and remove the guns. One of the most outspoken advocates for this law here in Maryland and really now nationally is a man who at the time headed up one of our county sheriff's offices. And he tells a story that one of the first ERPOs, maybe it isn't even the first ERPO that he filed or that he was involved with in his county, was a report of a 17-year-old who had made credible threats to commit a school shooting. And they were able to intervene, remove the guns, and get that young person help without, before he was able to carry out those threats. So yeah, we do see lots of instances that are quite similar to the fact patterns of the Georgia case in which ERPO is being used to intervene. Maybe I could also share just another paper that we published 2 years ago, and it looks at, I'm terrible at multitasking. Let's see if I can do this. It looked at ERPOs across 6 states, and we pulled out those ERPOs that were filed specifically in response to a threat to shoot 3 or more people. So it was an attempt to get at the use of ERPOs for mass shooting cases. So anyone want to take a guess at what we might have found in terms of the percentage of cases where an ERPO was filed? What percentage were filed in response to a mass shooting threat? Anybody have a guess?
3%.
75%.
Oh, 75%, 3%, quite a range. I would have thought, I think most of our team was thinking 3%, single digits. It was 10%, is what we found. So, again, and this was out of 6,500 cases. So it was quite a large number. But yes, we're definitely seeing ERPO used in response to threats of mass shootings, including school shootings. And we'll see what happens in Georgia now, because, if you kind of follow the pattern of when these laws are passed at the state level, oftentimes they're passed in the wake of a high-profile shooting, such as what happened in Georgia.
One of the questions that got asked in the chat in regards to this was also whether or not there were any model legislations from your standpoint that folks could look to, in particular, like a particular state's legislation that you see as being most ideal, with the caveat knowing that there are obviously variations per state.
We have a website on ERPO, which might be of more use. We're a national center for ERPO implementation. And so we have a number of resources on that ERPO.org website. But what I want to share with you is this model law that we just published, that we spent a lot of time really thinking about what are the key characteristics that should be included if states are passing these laws. And it's based on a lot of frontline experience, really talking with hundreds of people who are using these laws and trying to figure out what qualities and characteristics are most useful and really critical. So yes, we do have a model law for you to look at, in addition to the resources that are available on that ERPO.org website. So here's the model law. Oh, thank you. So yeah, so we talk about, I mean, the model law really breaks down, the different parts of the process. We also have a model implementation guide. Again, in Colorado, you all have an ERPO law. So the important work that's to be done from my perspective in Colorado is really on the implementation side. We also have a nice guide that talks about the implementation process that speaks specifically to that. I can also put that in the chat. But yeah, we've spent quite a lot of time trying to figure out how to maximize the impact of these laws, which as more and more research comes out, we are increasingly optimistic that this is part of the solution for addressing gun violence in our country in a meaningful way.
Yeah, this guide looks
So let me see if,
amazing. Is there a particular good do you think section, that people could start out reading within here? It would be like that you want to or I guess could orient our attention to, that might be a good first thing to read that has those recommendations?
I think just from a standpoint of the nuts and bolts of how, well, I mean, I'll say it'd be nice. I would recommend reading it all. It's wonderful. I think it's pretty, pretty user friendly, but perhaps the yellow section, that petition process, which more talks about the processes, as the name suggests. So it could give you an idea of how ERPOs work. It's perhaps the most concrete section.
Yeah, thank you. This looks like, I think, very, very user friendly, and very comprehensive for sure.
Yeah, it's the kind of guide that we hope that you can kind of just, glance quickly at and get a lot of information from.
Mm-hmm.
And then I also put the link to our implementation guide, which, might provide, it's more, again, as it says, it's really oriented towards practitioners and policymakers. So you have the law in your state. What can you do to make sure that it's being used in a way that's going to promote community safety? So lots of resources. I mean, if you're interested in this, I really invite you to peruse our website, to reach out to me. I'm happy to provide more resources if folks are looking for more information on specific aspects of this law. But yeah, I'm spending a lot of time on this these days, so always happy to talk to people about what we're learning.
Oh, thank you so much. In our meeting, we talked about one of our goals actually for the committee is, focusing a little bit more on our research, and kind of trying to work on really making some like evidence-based references for people, to be able to look at, because it's not, part of our standard curriculum within medical schools yet. Some medical schools, teach a little bit more than others, and have like a different way how they want to approach students on it. So we're working on our thoughts on, how to do some research. Do you think there are some good recommendations that you have for, students who are looking into research? Is it just reaching out to, experts like yourself, or anything like that?
Certainly, most of us who are in academia are here because we're committed to the educational mission. We want to be a part of, training the next generation of people, be it in medicine and public health, which is my field, nursing, whatever it is, right? So we have a commitment to the educational mission. So, most of us are quite happy to get those emails or phone calls from people saying, hey, I'm really interested in the work that you're doing. are there ways that, you know, I could be helpful, or you would advise that I could be a part of the scholarship that's evolving? And certainly there's growing groups of people around the country. I mean, when I first started working in this space, you know, there was our gun center, and there was a group out in the University of California, Davis, that was really focused in an intensive way on issues around guns and gun violence prevention. But there are many more groups that exist around the country nowadays, and plenty of opportunities for partnership and training on research in this area. So yeah, I would say just reach out, sort of look around, see who's doing work that you like. There's a variety of methods that people are engaging in this work. And yeah, start a conversation.
Well, thank you so much for coming and talking with us. We really appreciate, you know, your expertise on helping educate all of us. We're all, you know, learners and are hoping to grow in this way because we all see it as like something that's really vital, I think, as a part of, you know, physician education.
Terrific. Well, I'm happy to be here tonight, and thanks for your interest.